Okay, so today I will teach you about gout. Okay, so gout, there are 56-year-old men who come with gout and he has joint pain. Okay, and 3 days ago, his pain increased because he has 5 cans of beer and a pieces of porcine liver. Then he has swollen and redness of the left metatarsalophalangeal joint. His uric acid is increased than normal level. The doctor prescribed colchicine and allopurinol and recommend that he should avoid certain food. So I will introduce you about hyperuricemia. What is hyperuricemia? Hyperuricemia is you have high level of uric acid in your blood, more than 6.8 milligram per deciliter. And what is uric acid? Uric acid is the end products of purine catabolism, right? Or purine degradations. As you learn in class, you see that when you get AMP and GMP, you degrade to get uric acid. Okay, the intermediate is hypoxanthine and xanthines, and you use enzyme xanthine oxidase. Okay. So what is gout? Gout, you will have the condition of hyperuricemia. After that, you have high uric acid in your blood, right? It will lead to the deposit of the monosodium urate crystals in your joint. And the inflammatory response to the crystal cause acute and chronic gout. Okay, so normally this is a uric form, right? But in your blood, the pH is 7.4, is in the form of urate ion. Then it's attached with the sodium ion to get monosodium urate. And you can see that the monosodium urate crystal, or you call it tophi, it can deposit in your joint and cause pain, tenderness, redness, warmth, and swelling. Okay, and this you would call it chronic tophaceous gout. You also can have formation of uric acid stone in your kidney, or it's called urolithiasis. Okay, so the progressions, when you don't have symptoms, you have normal of uric acids. Once you have hyperuricemia, it still can be asymptomatic. But when you have monosodium urate crystal deposit, okay, this will cause symptomatics, and this is called acute gout. Then you will have symptomatic disease with the complications, and it's called chronic gout or tophaceous gout. Okay, so how to diagnose the gout? You have to use needles, okay, to aspirate the fluid, synovial fluid from your affected joint. And then you look under the microscope, you will see needles, sharp needle shape of monosodium urate crystals. So what is the cause of gout? It can be two causes. One is you have a decrease of uric acid excretions, or you can have high level of uric acid synthesis. Okay, so the main cause is from the uric acid excretions, and less cause is by urate synthesis. As I tell you, after purine degradation, you will get uric acid as the products, right? Okay, so the first cause is under-excretion of uric acids. So this one, you get the products after purine degradation, but you cannot get rid of it in kidney. So you have it increased in the liver. And this can be defect in your kidney, or people with condition of lactic acidosis, because lactate and urate, they use the same renal transporters. Or you can take certain drug, or you have lead poisoning. Okay, the second cause is come from overproduction of uric acid. When you have overproduction of uric acid, it means that you have to produce more purine, right? Because you have to have more purine to degrade to uric acid. Okay, so first one, you have a mutation in PRPP synthetase, or is the enzyme that make PRPP. Okay, this is the first step of purine de novo synthesis. Second, you have problem in the salivate pathway, or you have problem in HGPRT deficiency. Okay, and it's called Leach-9 syndrome. I will go in detail now. Okay, so the first one, PRPP, synthetase mutation. When you have the mutation in this enzyme, you have increase of PRPP. When you have increase of PRPP, then in the novel pathway, you make more AMP and GMP, and these lead to more degradations, and you get more uric acids. Okay, so this is the first one. The second one, HGPRT deficiency. This enzyme called hypoxanthine guanine phosphoribosyltransferase transferase, okay, and it's called Lise-9 syndrome or rare gout in the children form, and it's X-linked recessive disease. I will explain you, okay? So in the purine synthesis, they also have sulfate pathway, right? The sulfate pathway is the recycle. So you use hypoxanthine and guanine, okay? And this sulfate pathway, you put PRPP, okay? Use enzyme hypoxanthine guanine phosphoribosyltransferase transferase and you get IMP and GMP. But if you don't have this enzyme, what happens? The start material will increase, right? So hypoxanthine will increase, okay? So when hypoxanthine and guanine increase, it causes overproduction, right? Overproduction of purine. Then you have more degradation. Then you have what? Overproduction of uric acid, okay? Then you have lower amount of IMP and GMP. When you have lower amount of this one, the body the body make more de novo synthesis. Once you make more of de novo synthesis and you also have more of PRPP, then you have more degradation of uric acid and also overproduction of uric acid. Okay. So then for the treatment, there are 3 ways for the treatment. So you can do anti-inflammation agent or colchicine, right? Or you can get rid of the uric acid by, if you have underproduction, you take uricosuric agents or the drug called probenecid, okay, or sulfonylurea. This will increase your kidney to get rid of uric acid. But if you have overproduction of uric acid as a cause, you have to take allopurinol. Okay, so what is allopurinol? Allopurinol is a xanthine oxidase inhibitor. Okay, so it inhibits xanthine oxidase enzymes. Okay, so I will introduce about allopurinol. So allopurinol is analog of hypoxanthine. Okay, you see the structure here. Okay, so once you take allopurinol, then the hypoxanthine oxidase in your body will make it to oxypurinol, and oxypurinol will inhibit, okay, enzyme xanthine oxidase. So when you inhibit this enzyme, right, you cannot get uric acid, okay, and you have lower of uric acid, but you have high of hypoxanthine and xanthine, but this is more soluble and you can secrete in your urine. So this is the way to treat gout, okay? So what to avoid when you have gout? You have to avoid food with high purine. Okay, for example, in beer, they have a lot of yeast. So yeast has high purine. Liver, kidney, red meat, seafood, mushroom, fish eggs, or bamboo shoots. So everything that have high nucleus, right? In nucleus, we have high purine. Okay, you also should avoid alcohol, okay? Because when you take alcohol, the metabolism will make lactate, and the lactate, it will decrease secretion of uric acid. Then you have high uric acid in your blood. Okay, so as a summary, so the cause can be PRPP synthetase mutation, HPGRT mutations that cause high purine nucleotide, right? And you degrade, so you have high uric acid. When you have high uric acid, another cause that you cannot get rid of in the renal, proximal tubule, so you have high in your blood, okay? Then when you have high uric acid, it can be asymptomatic called hyperuricemia, right? Then it change to urate ion, and then it make a crystal monosodium urate, uric, and cause trophy in your joint. Okay, you can take information to the treatment. You can take inflammation drug or cortisone. You can get rid of uric acid in the kidney by taking um, probenecid, right? Or you can inhibit xanthine oxidase by allopurinol. Okay, so as you see in the case, you see joint pain as I show you. Okay, you have swelling, redness, and it's induced by you drinking beers and cocaine livers. Okay, and you take colchicine to increase inflammation, allopurinol to increase xanthine oxidase, and you avoid high purine food. Okay.